Okay, so I'm here with my little brother Caden. I'm in Central Texas on a vacation, so I'm looking kind of scraggly. But I'm gonna be showing you guys how to do a chest seal if Caden was shot. So I got our kit right here. The things that you're gonna need from it that you'll wanna grab quickly that are pretty clear in the kit is this that we're gonna use for the chest seal replacement, and then the tape which is right here, and then the gloves. So as always with an emergency, you want to call 911 first, especially with a chest involved gunshot. You're not going to have a lot of time, so they're going to need to get to the hospital very quickly. Even in the back of the ambulance, they can't perform surgery and get everything fixed that needs to be fixed. So this is going to prolong Caden's amount of time he has to get to the definitive care he needs at the hospital and get the surgery and get everything taken care of that was damaged. So Caden is shot right here, and we have an exit wound right here. So with a chest involved injury, sometimes you'll hear it sucking or going in, or you'll see like little bubbles, and that's going to be airway involvement. You can sometimes have it in the neck in certain areas too. You don't treat, stomach injuries or extremity injuries the same way. So we're only talking about, this area if there's airway involvement. So Caden's shot right here. The first thing that you're gonna wanna do is you're gonna wanna cover those spots. That way Caden can breathe good. So this is going to affect his breathing. And when he takes a breath in, it's going to cause air to go into those holes, and it's going to start putting a lot of pressure on his heart and blood vessels are right here, his lungs. He's not going to be able to take quick breaths, and that's going to cause him to die very quickly. So that's why we need to get this taken care of as fast as we can. So what I have in the kit for this is that you can get chest seals, which are expensive, and sometimes the adhesives aren't good because you're gonna have some blood obviously with an injury like this. So what we have to combat that a little bit is some waterproof tape. There's a lot of things that you can use. Obviously putting your gloved hands in areas where there's involvement is gonna help Caden to be able to breathe. There's also a procedure called burping the chest, which is where when Caden exhales out, you lift up for a second and it'll relieve the chest pressure and help prolong his life, which is what we're trying to do with the chest seal. So I have one in here, and how you use it is you open it up, and on the ambulance, people have used like pads before and other things, kind of like I was explaining with the glove. And you could use this side to quickly use as a patch, so you can do the other side. Of course, Caden's standing up, but if they're laying down, you might want to slap something on the front real quick and then roll them over, and then start working on the exit wound. But how I actually have these intended is to pull this out, unless you're using one of the other scenarios that I explained. And this stuff can tear, but because of that petroleum stuff that got on me for a second when I was sticking that on, my gloves are a little slick, as what tends to happen even with a little bit of blood. So I just got my trauma shears here, and I'm cutting some sections for it, and it's staying there for me to grab pretty easily. But so now what you do is you grab each of these corners, and you're gonna wanna tape them down. And you want to leave the fourth corner open so that stuff can drain out the air every time he exhales. So here's our gunshot that we're working on, and we got 2 corners right now, and I've dropped my 3rd corner, unfortunately. And so now, every time he breathes in, it's gonna keep the chest wall where it can work with him. When he breathes out, air is gonna come out and it's gonna slowly help him, and it shouldn't build up any pressure at all. So it's gonna prolong his life to help get him to the ER and ultimately to the OR to get everything taken care of. So that's pretty much everything. We still would have to, do this one on the back, and then like I was saying, if you want to throw the other one on there and work on one side real quick, and if you have 2 people, hold the glove right there, or throw down like a wrapper or something right there so his chest can work. That will work. The only problem is it's not gonna relieve the pressure every time he exhales. So like if we have that chest wall right there, it's just gonna keep whatever has been built up there. So ultimately we want to do something like this so that ultimately he can get all patched up at the ER. But thanks, Caden. Okay, walking through the whole process real quick. First I'm gonna patch this one up. You can lay on that wrapper. Plus we have that adhesive that we haven't removed on that side. So it will stick, it just isn't gonna relieve the pressure. So now I'm gonna open up the tape. And then as he's working to breathe, I will be able to assist him having that covering on right there. And then, like I said, that back side is being taken care of, just not draining. So 3 corners, preferably you want to tape the higher corners so that if there's blood draining out too, that can happen. This tape is waterproof tape, so even though his chest is a little sticky, he can still, it'll still stick. So we have that front side draining all the air out. This will work, but probably what we want is both sides to go ahead and be, taped up depending on what's going on. He got a little bit dirty because he fell down right there, so we're having to brush off everything. And I just opened up one of the gauzes we have in our pack and cleaned it off a little bit. I'll dry it a little bit too. Like I said, this tape is waterproof, so it does tend to work. Now I'm throwing that off so that he can drain air out with all these corners covering each side. And now roll completely over. We're having to conform it a little bit better. And there he goes. So when he sucks in, it is going to go with him. When he breathes out, it is going to relieve that pressure.
Thanks for watching. Make sure to check out Go Bags